Okay. Now, if I didn't introduce myself, my apologies. I was a little bit frantic bringing us all in to the webinar. My name is Kat Keane. I am the health educator for Arthritis New South Wales, and background is in musculoskeletal health, rehabilitation, and psychology. So as I mentioned, we are looking at hand and foot. We're going to start with hand anatomy and function. I think it's always good to start from a place to that we all agree upon, and we have a solid understanding of, for example, the function of joints being the hand, so we know how they are affected. And then if we know how they are affected and how they move, then hopefully we can come up with some ways to move them better, or have exercises that help us move them better. So as you will know, or be familiar with other joints in our body that arthritis affects, arthritis often affects, or really affects, joints that are synovial. So all the joints in our hand are synovial joints. And they start, well, arthritis can affect us from the wrist area down here, so the wrist joints, and there are lots of little tiny carpals. Okay, we call these little bones in here carpals. So we have lots of those, and if you will, you kind of consider them as allowing movement, and they have movement that happens between each one, okay, touching it. And I guess it's the sum of all parts, in a sense, that provides a lot of range of motion, okay? We go through that range of motion in a moment, but essentially they're sliding over each other. Our finger joints also permit movement, but they don't rotate, as you'll know. Obviously, we can curl our fingers into a fist and then straighten them back out as full function. And different joints of the finger, like we would see these from the outside as our knuckles. And if you've ever heard of perhaps your physiotherapist, your exercise physiologist, or your doctor talking of the joints, you might have heard them say the metacarpophalangeal joints, or an MCP joint. So that would be these joints here. So this main knuckle here. Okay, so arthritis can affect us here. The next one along is the proximal interphalangeal joint, or the PIP. And then the next joint above at the very end is the distal interphalangeal joint, or the DIP. So depending on different types of arthritis, will depend on where, what joint is affected. So the MCP, the PIP, or the DIP. We also have the thumb, okay? The thumb joint's a slightly different joint. We're not going to exactly size and shape, but it does permit movement. It does flexion and extension and abduction, but not necessarily a rotation type movement. And again, if you have a little look down here, depending on what type of arthritis you have, that would depend on where mainly. This is, again, generalizing in a sense. Often you'll find people with hand osteoarthritis. Well, it often affects nearly all of the joints of the hand, as you can see. But if you look over here with rheumatoid arthritis, it would significantly affect the wrist joints, those carpal joints. And again, the dips and the pips. Okay, erosive hand OA, often the pips and the dips, not necessarily those more proximal joints. And then hemochromatosis, I'm not sure if anybody's aware of this, but hemochromatosis is one of the most common genetic disorders in the westernized world. If we just talk of Australia, in Australia, white Caucasian often have or carry a gene with hemochromatosis, and it's essentially a condition that just, in layman's terms, you hoard a lot of iron, so you don't effectively use it. And then over time, what happens is the body doesn't use it, so it stays in the blood, just circulating. So it has to go somewhere. So over time, what happens is it builds somewhere. Sometimes it can build up in an organ, and sometimes it can build up in joints. If it builds up in joints, it actually causes arthritis. Interestingly, to treat hemochromatosis, we often just give blood. We let blood, and taking the blood out removes the iron. And doing that, it reduces the level of iron. That can help treat the hemochromatosis, so the high iron, and it actually can, the iron then can actually come back out of soft tissue like an organ. Interestingly, iron, even if you bloodlet, even if you try to get rid of extra blood to get rid of the iron actually can't come back out of a joint. It's sort of a one-way path, so it continually breaks down cartilage. Very interesting. Okay, so obviously these are just a few examples of different types of arthritis. And if you like, you can put in the chat if you have a different type of arthritis, if you'd like to share, and you can share with us whereabouts in your hand it might affect you. Because this is just osteoarthritis and rheumatoid arthritis, which is the main ones, but there can be others as well. Anybody have any different? It's okay. You don't have to share if you don't want to. Okay. So here are some other hand deformities. Some of these deformities can come directly from arthritis, rheumatoid arthritis, osteoarthritis, and then some of these can also be formed by tendons, problems with tendons, tendinopathies. So here we'll find with arthritis, typically we'll get these bulbous nodes that occur over those pips and dips. Okay, that's often a indicator or informs osteoarthritis. When it comes to rheumatoid arthritis, often the deformity is or can be a lot more severe, and it looks a little different. So here we have what we call a swan neck deformity, where the dip and the pip become angled in a way that it kind of replicas, I guess, in this sense, a swan's neck. Also, we kind of get this ulnar deviation from the MCP joints as well. So and as you can see here, so this is obviously an illustration here, but we actually have a picture here of hands. As you can see, they're kind of moving away towards towards the pinky side. Now, we call that ulnar deviation, where our fingers move towards the pinky side. And you can see here the swan neck deformities. Now, if treated, if diagnosed early enough, and if a treatment is found that works and that reduces the flares, inflammatory flares, this deformity may not occur, or if it does, it may occur much later and maybe not as severe. So again, I guess I'm making a point of the earlier that we diagnose and the earlier we start good treatment, this may not necessarily be the case or the case all the time when it comes to people with rheumatoid arthritis. I've just seen a few people here mention something in the chat. We've got actually a couple people here who say they have psoriatic arthritis, and this can, for some people, affects the dip, so those end joints, and the pips, also the wrist for Elaine. Thank you for sharing. And Sandra mentioned thumbs, dips, pips, and also her wrist as well. So there you go. So it's not obviously just the OA and the RA that can affect our joints of the hands. Okay. So let's have a little look at some hand exercises. We're going to start off quite basic. There's nothing fancy. There's no sort of magic pill. And you can see here, these exercises that we're starting with, again, are really basic. We're just making sure that we can move our joints. We're looking at the MC joint here, but also, of course, as we bend the knuckles, the dips and the pips, we're making sure that they can move the way that they should move. And so to do that, we're going to do a really simple exercise. If you were to lay your hand flat, or you can still do it in the air, it's just a simple finger stretch, like so. It might be straightening them out, and you may actually need the hard floor to help you do that. Okay, and then also spreading them out as well. So moving them away from the center or away from themselves. Okay, so remember our fingers can do a sort of sideways movement and then a flexion extension movement, but they kind of can't do a sort of a rotationary type movement. And then we have a finger lift or extension. So your hand is flat on the ground, and from that position there, you want to see if you can actively lift each finger off the ground or the table. Really simple exercises, something that you might like to do to warm up your hands, particularly if it's a cool morning or it's, you know, those cooler months, because I know that's when most people complain about joint stiffness and pain, particularly in their hands, their knuckles and their wrist. Now, remember, all of the exercises that I'm showing you here today or tonight, they are found online for free as part of our Get Moving Plus exercise library or suite of exercises. It's available on our website. It comes as a booklet, and it has these exercises and more. And it actually goes through a little bit more detail about how to perform them. So you're not missing out if you're madly writing these down. It's all online for you for free. Here we've got some lovely tendon glides. This is a really common exercise given to people who may have, due to arthritis, limited range of motion, and because of that, tendons have become perhaps shortened, they feel stiff. We want to try and stretch them out. We also want tendons to be gliding smoothly, and for them to glide smoothly, we need movement, because movement helps facilitate synovial fluid within joints, but general fluid around the sheaths that they move between. So here we have the first one. You'll place your hand or your elbow on the table like so, and we're going to make a hook fist like so. So you're keeping the MCP line nice and straight, but you are flexing the dip and the pip. And it doesn't actually particularly matter which way you go with this or what order you do. But here we've got one, make a hook, then make a tabletop. So again, you try to keep the wrist straight. I have trouble with this. Wrist straight, and we flex solely at the MCP. And then you're going to bend at the pip, and then you're going to bend at the dip, okay? And then you're going to start from the top. Then you're going to extend the MC, extend the dip and pip. Then you're going to bend the pip, bend the dip, and you start again, okay? And you kind of get a nice tendon glide happening. Also, developing, but maintaining strength through your fingers as well in those tendons. Okay. Here we have some passive finger flexion. Now, a lot of these exercises, particularly the passive ones, are generally benign, and I say that, and what I mean by that is they're not going to cause damage, or they're not really going to hurt you. But of course, any passive movement like this, you don't want to force a joint that is deformed significantly or severely deformed into a position that it just can't go, because at the end of the day, our function is guided by our structure. And if that structure is severely compromised, you can't push it in the opposite direction, potentially without a lot of pain, and then potentially at risk of a injury or damaging. Okay, so if you don't have massive significant deformities, then passive finger flexions or movements are totally fine and can be good to help that end range of movement, to gain that end range of movement. So with passive finger flexion, using the crease lines, okay, of your fingers, of your dip and your pip, okay, you can see I've even drawn them on my finger as well. You kind of want to use your thumb as a bit of leverage and try to create a little bit of flexion in each individual joint. Okay, so that's a bit of flexion, passive flexion. So you're doing it for yourself. You're not trying to actively do it. Okay, then using your thumb again as a bit of leverage, place it at the pip, the proximal, or that middle joint, knuckle if you like, and again gently guiding it into flexion. And the same for the MC joint. Okay, so placing the thumb inside and gently pulling over. So that's to guide you into movement, to see what movement you have, or to gain that little bit extra. I do also encourage you to actively pursue these movements. You may have to hold your finger and just bend the top one and then just the bottom one. Okay, but again, you want to maintain movement, passive and active, through each of the joints, and actively also because you want to maintain strength. Okay, here we've got some great ideas for strength and dexterity. Obviously, when we start to lose, or potentially if we get some deformity, we get larger knuckles, they start to deform, we do lose dexterity. We don't want to lose that. We might like our knitting, to our writing, to anything that involves small fine motor movements. Okay, so using paper clips or any small object, okay, tipping them out on the table and using a pincer grip, okay, picking them up and putting them back into the jar. You can use pins, very fine. You can use buttons, anything you want, anything you got lying around. And not just use the index and thumb as a pincer, but try the other ones as well. Okay. We've got putty, and we've also got like those stress squeezy balls. They're also great too for trying to increase pincer grip strength. Okay, so holding down nice and strong. So all of these little movements here help with movement coordination and strength when we do things like opening doors. That's very important. Got to open your door, unless you got a sliding door, of course. But gripping a door handle and turning it, or gripping it and pulling it down. So those things are important. Some more ways that we can get movement, but with strength, is doing a finger spread exercise, but having a band around our fingers. Okay, so you can use all 4 if you want, or 2. Okay, I suggest getting a smaller elastic band for that. Some people love putty, and they can use it in a similar manner. Plasticine, Play-Doh are also really great things. What's the other one? Blue tack. Blue tack or similar, those sorts of things are also really good for just general play, but to maintain movement and strength. We've got the thumb. So the thumb is often affected, okay, particularly down low. And so we need to maintain what movement we have and the strength we have of it. Okay, so general movements, we should be able to do what we call opposition and reposition. Okay, so that movement across the palm. Okay, might be touching my pinky. Okay, I should be able to do this. So that's an exercise in itself. Okay, to do this or similar movement with a band, so we pop a band around like so, and we take the thumb away from the index finger against resistance. And again, for muscle in or thumb intrinsic strengthening, so the muscle, the very small muscles within, I mean, they're all very small. You're going to trace the white strip of a tennis ball. So you slightly, this one's really good actually, because you have to work with the dexterity of slightly twisting the tennis ball while you're trying to follow the thumb. Follow with your thumb, follow the white line. Okay. Now, your thumbs, your fingers, they have very small muscles that make them work. Okay. They also have long tendons that make them work on the outside and on the inside that actually join to big muscles in our forearm. Okay. So sometimes if we give that a little self massage up and down the arm, whether or not it's because of the work up here, it could be, it could not be. Either way, this can be a little bit tender. So we can always give ourselves a nice squeezing type massage. Okay. But to ensure that we have the range of motion to go through flexion and extension, okay, we can stretch these muscles, okay, our flexors and our extensors. So to feel a stretch on this side of my arm, okay, I want to straighten out my elbow and then pull my hand towards me. So my palm is facing towards me. Okay. So you should feel a nice stretch along this part of the forearm. Great. And then if you wanted to feel the stretch on the inside, okay, then we're going to do the opposite. We're going to straighten out the arm and we're going to pull the fingers and the wrist back. And you should feel, again, a nice stretch in this part here. Holding a stretch for as long as you like, as long as it feels good, okay? Now, for that particular movement of the wrist, you might be feeling a little bit stuck, a little bit stiff, potentially from our arthritis. So what you might like to do is passive movement or passive motion of that wrist. Just like we did passively with our fingertips, we can do the same with our wrist. So resting your elbow on a table, you want to place your hand over your palm like so, okay? And again, we want to gently guide into flexion. Gently guide. You can add a little bit of traction if you like. Often that's just a bit of skin traction, but gently pull up with it as well and gently move in and out of flexion. Okay. The same thing with extension. So you're just going to grasp your own hand and you're just going to gently apply a little bit of overpressure. A little bit of overpressure. Okay. Now, to feel, you can actually get a bit of a stretch in the fingers if you were to straighten them. So you get some passive movement of the wrist in extension. But also, if you keep the fingers nice and straight, you can feel some stretching here as well. This is the extensor and flexor stretch. We just looked at that one. Okay, before I move on to the foot, I was wondering if there are any questions. Some are saying too painful. Absolutely. So remember, these are just exercises, movements, or stretches put out there. I always advise that these exercises, passive movements, active movements, If you are not sure that you can or you should do them, I always advise and encourage just to get a little bit of direction from potentially a physio or an EP if you see one. Okay, some of them may be too painful. Sometimes you may not be able to do them at that particular moment for various reasons. And one obvious one being there's too much swelling, so a lot of joint effusion. Okay, but also perhaps you're going through a bit of a flare up at the moment. And, you know, pushing into end range of a joint may not be the best thing for you at that particular moment. So it's kind of picking and choosing what works for you. And instead of focusing specifically on a joint, one joint at a time, maybe it's just general work for you and doing as best as you can through a simple hand stretch. If there are no hand or wrist type questions, if you like, I invite you to come off your mic and you can ask me. If there aren't, I will move on to the foot.
Can I ask, how many times should you do these movements?
Yeah, that's a really good question. Number one, when you look at the booklet online, it gives you some parameters around that. But while we're here, it's obviously a good question and I'll address it. So when we're stretching, like I mentioned with stretching, arbitrary number, usually, as some people would say, 15 seconds, 20, 30 seconds. I think for when it comes to a stretch, just holding it until it feels good or it feels better. There's no real consensus there. When it comes to the other exercises, let's just say, for example, that finger spread. Okay. I've had people say that they do 50 of those a day and they spread it out during the day, which means that they might do, you know, 2, 3, up to 5 sets of anywhere between 10 to 15 repetitions. So repetition is how many times you do that. Okay. And then a set is how many sets of those repetitions you may do. So again, without getting too technical, you might like to do 2 to 3 sets of anywhere between 10 to 20. I say it very broadly, I know, but that's because I don't know everybody's sort of condition, severity of deformity or pain, but working somewhere within those parameters. Okay, now let's have a look at the ankle anatomy and function. Oh my goodness, could there be a more complicated joint going around? There are 3 joints really that, well, many, but 3 main joints that make up this ankle, if you will. But I just want to highlight this word over here. It's a very complex synovial hinge joint. So it moves in one sort of plane, being up and down, and mainly from this joint here. So the tibia, the fibula, so the 2 long bones of your lower leg, they attach. They articulate with a bone called the talus. Okay. And you can see these 2 major black lines here, and these form different parts of the foot and the other sort of main joints as well. The calcaneus, that big bone there, is like your heel bone, okay? And then your tarsals are equivalent there to your carpals, okay? And one way to remember are your carpals for your hands and are your tarsals for your feet is, I drive my car with my hands, and car is for carpals, and I walk on the tar or the ground with my tarsals. You don't need to remember that. That's just some you know, fun. And then we've got the metatarsals, again very similar to metacarpals, and then phalanges. So same as our foot, same as our hand. Now, all these movements from these different joints, so the actual, the ankle, the talocrural is what we call the ankle joint, the subtalar joint, we call here in the transverse tarsal joint. Those joints, their movements combined help us do dorsi and plantar flexion, which is just movement up and down like this, and inversion, eversion, and then adduction, abduction. Okay. Our foot needs to be highly flexible, highly adaptable, highly versatile, because it needs to adapt to the ground underneath it and a lot of forces as well. So hence why, and it also needs to spread and distribute impact and weight. So it needs a lot of moving parts to do that within. Okay, but that just means a lot more moving. If a lot more moving parts, we have a lot more chances to form arthritis in those joints. I was going to say I get a hands up, but I can't see everybody. I'm not sure if everybody can see everybody else. So perhaps in like the chat box, who has arthritis of the foot? And if you do you know what part it might be? It can be the ankle, like the talocrural joint, but often it's the tarsals down. So we're looking at mid joints and the dips and the pips of the phalanges. Does anybody have arthritis of the foot or ankle? Hello, ankles and toes. Yes, tarsals, the foot, the mid joints. So you're probably looking at here, this midfoot area. Yes. And it can be, and it, yep, can be painful. You feel stiff. Got rheumatoid arthritis. Yes, because rheumatoid arthritis, if you're not sure, often affects the peripheries. And when I'm talking peripheries, like the hand and like the foot. Absolutely. We can get psoriatic arthritis. Yep. Oh goodness, some people are saying it can feel like walking on glass. So I'm assuming quite painful. I'm wondering also if you have some sensory issues there as well. If it's just mechanical nociceptive pain from the joint itself, or are you having some other sensory issues if it's feeling like fire or like glass? Well, one very, very thorough diagnosis there, an X-ray of the hallux valgus deformity. We're going to talk about that actually in a moment. Sylvia, so thanks for sharing. Achilles heel, so maybe the calcaneus. The Achilles tendon runs down the backside here of the fibula and the tibia, and it joins and attaches right around here. And my dad, who is 70 something, decided the other day that he would put my sister's car, which is a humongous, huge four-wheel drive. He decided he's going to put it in neutral and push it forward, just, 5 centimeters. And as he did that, he pushed his heel to the ground and what snapped? Here's Achilles tendon. Dear me, dear me. So not necessarily arthritis, but Achilles tendon. Okay, so we've got a fair few people with arthritis of the foot. Okay, well, let's have a little bit more of a look at it. Hey, all right, here we go. Okay. Again, I don't know people's, well, I do know some now. I don't know the severity. I don't know the pain. I'm saying I don't know your individual case, what you can't do. But for to see what range of motion you do have in that main ankle joint, that talocrural joint, we do a heel to wall test. It's a test of flexibility of that joint, but also of the gastrocnemius and soleus, which runs into the Achilles tendon. So the muscles, the calf muscles. We can use it as a test and an exercise. So what you want to do is pop a ruler down, okay, make it flush with the wall. And you want to start with your toes as close as you can to the wall. You want to bend your knee forward, touch your knee to the wall without lifting this heel, not this one, this heel off the ground. Then what you want to do is try and walk your foot back as far as you can while your knee touches the wall, but your ankle stays on the ground. For the best or the optimal range of motion that ankle should have, your foot or your toe should come back about 10 to 12 centimeters. So that's what you're aiming for, because you need that type of range of motion for when you walk. When you do walking, this motion here, this dorsiflexion here actually occurs to have a normal stride length, so you're not shuffling. Okay, so sometimes that happens as we get older. We may have, not even as we get older, it depends on, I could have an injury now of my ankle. I could roll my ankle or break it. It could get really swollen, and if I don't rehab properly, I'm not going to get that dorsiflexion back. And so when I walk, my stride might look a little bit different. I might walk on that side a little bit differently, and maybe that's okay. But I guess symmetry is best, because I guess it reduces a lot of risk of falls, for example. And I maybe don't compensate using my other right knee or my other left hip to gain more range of motion to make up for the one that's lacking. So this is what you don't want to have happen: the heel lifting and the knee and trying to touch with your knee. So number one, it's a test. Number two, it's an exercise. So test yourself if you can. And then what you want to try and do is stretch the calf muscle, okay, in case it's muscle you're losing flexibility because tendon and muscle are at play. Or you want to try and do some movements, which I have over here, to try and increase joint flexibility. So let's tackle joint flexibility. So we're looking at dorsiflexion exercises. Now, I understand people looking at these exercises might feel like there's just no way I can get down in that particular position. And that's understandable. There are some passive exercises that can be done to you. But obviously these ones here I've got for those who could probably get into this position. If you can't, I would encourage you just to move in and out of range here. So keeping the heel on the ground and moving the knee to the wall and back, to the wall and back. So what I want to do is bring a little bit of resistance to my ankle here. So I want through this resistance to be pulling back this way while I take my knee over the top of my foot. I want to make sure my ankle though, or my heel, should I say, stays on the ground while I do this. And I would do maybe 3 sets of 15 to 20 reps of these. And if you can get down there, try to grasp your calcaneus, so that big bony heely part. Try to grasp this. And then with a tunnel, or with the webbing of your thumb, place that over the top of your ankle. Okay, so you're holding down the calcaneus, you're placing the webbing of your thumb over the top part, front part of your ankle. You want to push down with this hand, and this hand wants to push into the ankle while you bend over the top. Okay, so you're essentially creating a similar scenario as over here, but you're doing it with your hands and not the resistance band. So that can help create a little bit of mobility under a little bit of load and weight to get some dorsiflexion occurring. Now, sorry, before I move on, this can be done if you were to sit on your bottom like a chair, and if you can get your foot up onto your opposite knee, and you can create general range of motion and movements into dorsiflexion. So moving your ankle like this, but what you won't have is the weight of your body, which is probably needed and more it replicates walking more, doesn't it? As a weight bearing exercise. Okay, but another thing that we could do is to build up strength in a calf raise. Okay, so on the ground we can lift our heels off the ground, use the wall or something to help for balance, that's fine. Okay, so that helps to strengthen the calf. And then to increase range of motion, but with strength, we can use a step. We can drop our ankles off, which again is good at developing or encouraging dorsiflexion. So this angle is getting smaller, and then we can lift our body weight up into the air. So that's strengthening of our calf muscles. The ankle alphabet. This is a good one for general mobility of that major ankle joint, the talocranial joint. But it also encourages that inversion, eversion, and adduction, abduction from the subtalar and the mid-tarsal line joints. Okay, so ABC all the way through. So have your ankle, you know, as it is here with a towel. So the ankle is off the ground. You can do it from a seated position and just lift your foot off the ground so it's not resting there if you like. And you can write with your foot as if it were a pen, the ABC. I know it sounds a bit silly, but it's really good for range of motion through the ankle joints. If you don't like ABC, you can do your name. Okay, toes. Oh dear, toes. So we had people with ankle and mid ankle. I saw some people say that they had some issues with toes. Okay. So arthritis can certainly contribute to deformities of the foot, and the likely culprit is often an autoimmune rheumatic condition like rheumatoid arthritis. But we know other forms of inflammatory arthritis can affect our joints. So for example, gout is a form of inflammatory arthritis. It's not autoimmune per se, like a systemic autoimmune, like a rheumatoid arthritis or psoriatic arthritis. But we know gout can affect the big toe. And that's really just because of gravity. We can also have bunions. So we can have this hallux valgus deviation, which just means that this long bone of the foot starts to move inwards to the to the midline of the body, if you will. Okay, and then the other joint, or from this joint, the toe then starts to move across the foot. Okay, and that's the valgus there. So this angle here, and that can increase, causing pain and deformity. Not only that, because it encroaches on the second phalange, this poor little guy, he can go one of two ways. He can go underneath. I don't know why I'm saying it's a he. Could be a she. It's just a toe. It could go underneath, and it could also end up going on top. Okay, so it's sticking up on top, or it's getting caught underneath the big toe. So that's not really good when it comes to walking. I'm assuming that might not be very comfortable. And similar to rheumatoid arthritis, where we can kind of get that swan neck occurring, okay, of the phalange, of the fingers, we can get a hammer toe, for example, and we can get other deformities occurring as well. Okay, we can get some ulcers, and we can get a lovely callus forming as well. So our joints should look nice and smooth and white, but if affected by arthritis, so general inflammation of a joint for whatever reason, it often doesn't look nice, white and bright. It's often red and inflamed. The cartilage wears, and the soft tissue around the outside is also compromised. So here we've got a lovely, so that lady who just mentioned, I think it, was a lady who mentioned that she just recently had an x-ray, and I think this is what she was talking about. So if you have this sort of that bunion occurring on the outside of the toe, the big toe, and you're kind of getting that deviation of the fingers, or in this case, the toe occurring, that's what it looks like. This would be a foot that's unaffected by a bunion and or arthritis. And you can also see here, what's happened here? So this toe here is also, there's something happening here. You can see that a lot of them are actually deformed. So I think we've got some joints here that would be in flexion, and these ones more into extension, but these ones have certainly deviated and are very, very deformed, and that might be very painful. And imagine trying to walk with that. You do not have the adaptability as you do with the foot and toes that look like this. And I wonder how many of us may have this, even if you don't generally have if you don't have a rheumatoid arthritis, for example. I wonder how many people experience this because of the lovely shoes that we've all shoved our feet into for so long. Often, traditionally speaking, it's always been nice to have smaller feet and to have shoes that have lovely little points. And they do, it looks nice. But this is what's happening on the inside. So we have a very, what we call small or narrow toe box. That's okay if you've got a narrow foot. Regardless of having a narrow foot, when your foot lands on the ground, it splays, it spreads, the toes spread and extend. So even having a narrow foot, that still needs to occur. And often the shape of the shoe restricts that movement. And what we can see happening over time, particularly women's shoes, but it also happens in men's shoes too. If they have a point coming back in, it forces the big toe across, which then can inevitably end in a bunion occurring. So what I've tried to advise is to try and find a shoe that has what we call certainly just a wider toe box. Okay, more of a foot shaped shoe, which sounds silly because of course it should be, but often they're way too narrow. And we don't have a lot of them. They are starting to catch on trend now. So there are a lot more foot shaped or a wide toe box shoes coming along. And you'll know this is because often the case is you can't find a shoe that will fit the foot the way that it needs to work mechanically. And then sometimes we'll end up putting people who are quite deformed like this into a slide shoe with the straps on the top. Okay, and that's just the way that it is. But I wonder how different it would have been if we weren't forced to be in these smaller shoes. Okay, so how can you help that? Having arthritis or not, being at a bunion is a deviation and a deformity in itself, but it'll inevitably break down cartilage and cause either swelling or cyclical inflammation. So it's an arthritis. We can do some movements here. Okay, so these can be very, very painful to do if your that big toe does start to flare. When you walk, the end stage of your foot strike, so you hit with your heel. I know I'm using my hand, I do apologize. You hit with your heel and you'll hit the surface with the rest of your foot. But the last thing that comes off, this is going to be my big toe, everybody. The last thing that comes off is your big toe, okay? It needs to go into extension as it does this, okay? What happens when we have that bunion, we lose a lot of that extension in the big toe, and that makes walking very difficult. So when that's the case, what we need to do is pull back on activity. So length of our walk that we might do, the frequency of the walk that we might do. We want to reduce the high heel wearing. If you wear high heels and you've got a bunion that hurts or arthritis in the toes that hurt, reduce that, because that then you're tilted in this sense. And instead of just pushing all your weight through your heel, you're now then putting it through the one joint that doesn't need it. Okay, so we need to modify a few of those things. Okay, when the pain eases, the inflammation dies, we want to try and do some of these exercises. So See how our foot's nice and flat? We want to try and do some toe, big toe as well, all toes, but big toe extension. So flat toe, big toe. Then just like our fingers doing spreads, we want to practice doing that with our toes. So spreading them out. And then of course, we covered that when we did the heel raises for the calf. But again, that's fine because it also helps with tendons and muscle strength in and around and underneath the foot. Lastly, I want you to try and think about using some tape if you like, putting some tape on the ground, lining your heel up with it. And if you've got a deviated toe, you want to try and say that's the tape on the ground. This is my big toe and it's slightly deviated, okay, away from the midline. That's what it does. What you want to try and do is bring the toe up and back to the line that you've drawn on the ground, okay? So imagine there's a line here, okay, on the ground. This big toe, we want to move it across to the midline, okay? Back to the center line. So that's another really fantastic exercise that you can do to strengthen those intrinsic big toe muscles, to engage and to strengthen and bring that big toe back as much as we can. Here's some other exercises that you can do. Now, I've got a bunion, and it can be very painful. Doing this exercise here is good, but I shy away from it when it's quite red and inflamed, because that's going to hurt me a lot. But when it's died down, the inflammation's died down, I'm no longer in any pain. I lose a lot of that mobility. I don't know about you, if it happens to you, I lose a lot of that mobility. But when that's all gone away, I will do these exercises to ensure that I've gained it back after it's been sore or inflamed. I'm almost done. I do know that we've just gone over. I guess I did start late. I'm almost there. Here we've got a rolling exercise. You can use a ball. You can use anything you like. Like some people like to use, what are they called? A water bottle. And they put that underneath their arch of their foot. Some people love this for when they have, oh goodness, I've just lost the word. When the tendons underneath the foot get really sore. Anybody know what I'm talking about? You know what I'm talking about.
Contracted.
Plantar fasciitis.
Thank you. Plantar fasciitis. Thank you so much. Someone who said contracted probably is on the right path too. So yeah, plantar fasciitis is another common and co-occurring condition with arthritis and other deformities of the foot or conditions. So that can be very helpful. If you've got to go, that's fine. Some strengthening exercises with a TheraBand. Remember, these exercises are on our website in the Get Moving PDFs. And the last one here is making sure the toe has a little wedge underneath it. So this person's using a towel, okay? So he's rolled it up and he's put it underneath his both big toes. You can see there's extension there. And then he's actually getting more extension by putting more weight through it, which is his body as he has come up onto the balls of his feet. So that's another really good one as well. Okay. Last ones are some mobilizations that you might like to do. So here I'm going to place my thumbs on the long bones. So say, you know, the long bones here in your hand, you have them on your foot. These are the ones on top of your foot. And you're going to place your thumbs on those and you're going to try and wiggle them up and down as much as you can. So try to bring back some mobility to those smaller joints. Here we've got like a ringing action as well. Okay. So essentially holding the hands like this along the foot and actually doing like, don't do a Chinese burn, but it's that opposite movement that you want. Okay. And the calcaneus, holding onto the calcaneus and actually moving it forward and back. Now you're not going to get that much movement, much smaller than that, but you do want to try and get a little bit of movement in there. Okay. And this is what I was talking about before with the finding shoes that may accommodate a wider toe box and accommodate your foot a bit better. And then people sometimes ask me about splints and taping and spaces. And these are okay. They're very rigid. But this splint here is anyway. And sometimes, particularly if you've had maybe some people have surgery on their big toe, and that might be helpful for those instances. But the exercises, so moving that big toe back to center line is one of the most best things that you can do. Sometimes taping the foot. I don't have a picture of that, but a podiatrist can help you. It just provides a little bit of support. So that can be good as well. Okay. So as you can see here, just sorry, ignore the words on the slide, but these, we've got these Get Moving Plus PDFs. They're all on our website. My apologies. These are spine, this is shoulder. We also have one for upper limb and lower limb, and respectively, you'll find the hand and the foot in those, the exercises in those. Okay, that brings us to the end tonight. Thank you for coming along. Apologies for the inconvenience in the beginning. We have technically been an hour from when I started. I'm just sorry, we're 10 minutes over. There's a few comments in here. If you've got any questions, please ask. You can, or if you have to go more than fine. This was recorded. You'll find it on our website. Welcome to come off mic and ask me as well. If I'm not addressing your question, then it's in here.
Yeah, could I ask, Jan, I have acute on chronic tarsal joint osteoarthritis, effusion, etc., and it contracts up, and I have to wear a lace-up shoe to keep it contained at times, and then it causes a bit of fusion around the ankle. And it really is quite painful. It's ongoing, been with me for 12 years, and there's not much I can do about it. But I just wondered, have you any thoughts as to just to contain it a little more?
That's a really good question, and thank you for sharing. The expert here on how to deal with that would be you. I wonder, and you probably already have, if and when you were to take off that shoe and you did have a fusion or that swelling, how do you I guess go about managing that? So with swelling, it's always good to have that foot slightly elevated above heart, which means you lying down flat and your foot up. Yes. And that helps to pull that fluid into lymphatic system and then back towards the heart and just disperse it. The other thing could be, and I don't know if it's the right answer, but one of those stretchy tube compressions, that could also help. I don't know whether you probably already tried that.
I have. Thank you. Yes, I put it on a pillow at night. Yeah.
Good. Yeah. Unfortunately, there are always going to be ceiling limits to these things, and it's just how we manage that. And for you having it for 12 years, you probably already know how best to manage that. It's unfortunate, and I can imagine that would be quite painful at times.
Yeah. Thank you very much.
Thanks, Lynn. All right. Anybody else? Thank you, must go. Thank you. Thank you. Everybody looks like they've got to go, and that's fine. Could a podiatrist lace your shoes differently to assist the swelling? Oh, I don't know whether that whether that was in response to you, Lynn. I'm not sure. They could. I don't know the answer to that. But you could ask. Okay, I think that's mainly just saying thank yous and everybody's going. But please shout out now if there's a message that you'd like. Oh, sorry, I'm trying to read the messages and talk. If there's a question you'd like to ask, then do so now. Hi, Jeanette?
Yes, I was just wondering, I tend to get a swelling around the ankles. It's quite, I'm wearing Brooks shoes most
Yeah.
of the time, and it's just from the top of the sock up, and I've got this, this
Yeah.
ball around the ankle. Yeah. Is that just sort of, I just don't know how to get rid of it really well. You sort of put your feet up at night time, but yeah,
Yes.
I just wondered.
Swelling can be for a number of reasons. One of them is the pump mechanism back to the heart. And so sometimes if that's not as efficient, we get a lot of interstitial fluid pooling down low because of gravity over the day. So that could be more likely